This is part of our regular CHF Talks webinar series, series we've put together for members and stakeholders. I'm here on Ngunnawal in Canberra, and I'd like to acknowledge the traditional custodians on the land I'm on, emerging leaders past and present. Our topic today is COVID vaccine safety. So it's very much an informational webinar. We wanted to bring you the most up-to-date information we could on COVID vaccination. So it's not so much an issues-based webinar, which some of ours are. And clearly it's topical and timely. It feels like there are new developments every day on the COVID front. Right now, we've got new lockdowns in some of our major capital cities. We've had recent TARGI advice regarding eligibility for AstraZeneca, and advice that Pfizer is the preferred vaccine for those 60 and under. We've got Medicare support announced for GPs to counsel and have a conversation with patients 50 and over who may be hesitant. And we've got even more recent announcements from last night's National Cabinet that people under 40 can now opt to get the AstraZeneca vaccination after a conversation with their doctor, a national scheme for indemnifying GPs, and mandatory vaccination for aged care workers. So we're very pleased to be joined today by three very eminent and very busy in-demand people. Professor Michael Kidd, Deputy CMO, a face that you would be known to many of you, and thanks again for your time and welcome back, Michael. Consumer Advocate Diane Walsh, and Dr. Ruth Stewart, the National Rural Health Commissioner. So we've got limited time with Michael. He's been called away, probably not surprisingly, to an urgent AHPPC meeting. Before I ask Michael to give a more general update, I think we will cover some of the really pressing questions that we've received in advance with Michael, just so that we can get those out and aired. So Michael, if that's okay with you, we might go straight to questions. What would you say to consumers now that access to AstraZeneca under this new GP indemnity scheme has been opened up to those under 40? Clearly, there are factors that patients need to weigh up very carefully. What are they?
Thanks, Leanne. And firstly, huge thanks to you and Consumer Health Forum for running this webinar and all the others that we've been doing together during the pandemic. And as you say, it's a very worrying time at the moment with what's happening in different parts of the country. So the National Cabinet last night agreed to open up the availability of the AstraZeneca vaccine to people aged 40 and under, and this the advice really hasn't changed. So the medical advice hasn't changed. The advice from ATAGI, the Australian Technical Advisory Group on Immunisation, remains that the Pfizer vaccine is the preferred and recommended vaccine for people aged under 60 years of age, and that the AstraZeneca vaccine is the preferred and recommended vaccine for people aged over 60 years of age. But what is different is that up until now, unless you've been a healthcare worker or a quarantine worker or someone with serious chronic illness, if you're aged between 16 and 40, you haven't been able to get access to either of the COVID-19 vaccines. And now there is the possibility of getting the AstraZeneca vaccine. But if you decide that you would like to do that, it's very important that you're doing informed consent, so that you're talking with your GP or with the people at the vaccination centre that you're attending, balancing up the risks and benefits for you in receiving that AstraZeneca vaccine, or whether you might wish to wait until it's your turn to get the Pfizer vaccine. We will be getting more doses of the Pfizer vaccine coming into Australia during the next quarter, July, August, September, and then a lot of Pfizer vaccine coming into Australia in October, November, December. So medical advice hasn't changed. The opportunity is there. If you are interested in looking at getting the AstraZeneca vaccine, I recommend you go to the Australian government website, health.gov.au. Have a look at the consent form for vaccination. Just read through that so that you're making an informed decision. And also look at the patient information, particularly the patient information about the side effects of the AstraZeneca vaccine, and again, make an informed decision.
Thanks, Michael. And you talk a lot about informed decision making there, and that's so very important in this space as well as healthcare generally. Karen Price, the RACGP president, commented on morning radio this morning that patients should do their own research, which in part is what you're advising and in part is what we want to encourage people to do, obviously. But this surely has to be a process of informed decision making, and you've pointed us to some very useful resources on the department's website. Just related to that, I'm just so interested in your comment on that in the first instance, but also related to that, there was a Medicare rebate announced for GPs, and I think it's only GPs, correct me if I'm wrong, to counsel and spend time with patients to have the conversation, which is really important. Nothing worse when there's high anxiety, patients being, feeling like they're on a conveyor belt going in and getting a vaccine put in their arm without some of that reassurance for many people. So is that rebate was announced for patients 50 and over. Is that going to be extended to the 40s and under, given last night's announcement? And I know it's a very recent announcement, but that would seem to have a lot of merit.
So firstly, on the rebate, you're exactly right. That was introduced to allow a patient to have an in-depth clinical discussion and assessment with their GP about getting the vaccine, and particularly to address any concerns that people might have about receiving the vaccine. For those 50 to 59, getting the Pfizer vaccine. For those 60 and above, getting the AstraZeneca vaccine. With the announcement last night, we're now looking very swiftly as to whether that rebate should be opened up to people who are younger to allow them to have that sort of in-depth discussion as well. So there'll be more information coming out about that, I expect, over the next few days. But you're right, if people are going to do their own research, please go to the resources that you can trust. Please go to health.gov.au, have a look through the resources which are there. One of the resources is a table which shows you the relative risks and benefits of getting the AstraZeneca vaccine depending on your age. So it looks at what are the risks if you were to be exposed to COVID-19 and get infected with COVID-19 versus the risks of these very rare side effects, but very serious side effects, which can occur with the AstraZeneca vaccine. That's the clotting syndrome, it's called thrombosis with thrombocytopenia. And so it's a matter of balancing that up. Now, the benefits of the vaccine are there for everybody of all age groups, but obviously the people who are most at risk are older people. And as you become, as we move down, as people are younger, their risks of developing serious disease and dying from COVID-19 decline. Doesn't mean you're not susceptible to getting COVID-19, doesn't mean you can't get those symptoms of the long COVID syndrome and problems if you get infected. So everybody should be doing all they can to protect themselves and prevent themselves from getting infected with COVID-19. But the information is there on the website for people to have a look through, and useful to have a look at that before you go and talk to your GP about the possibility of the vaccine.
And we've got a comment, Michael, just reinforcing that, and that's certainly CHF's view as well, that the source of information, I mean, if we can give consumers in the community a clear and simple message, it's make sure you're getting information and critical information from the most authoritative sources at every opportunity. Just back to, it's not so much a consumer issue, but I think it'll be one that consumers will be interested in knowing the answer to, question, and just a message to our participants too, that if you do have questions, please put them in the Q&A box and we will attempt to get to them during the webinar, certainly get to them after the webinar in conjunction with the department and get the answers to those back out to you. This question, Michael, is about, is there indemnity for nurse immunisers for the under 40 age group as well as GPs?
Yes, great question. So the indemnity arrangements were only announced last night, so they're being worked through as well. So again, more details will be coming out over the next few days about how the indemnity works, which vaccine providers will be covered by the indemnity. And very importantly, what does the indemnity mean for the consumer? For the person who's receiving the vaccine. So very important that people understand that as well. So there'll be more information. We've probably held this webinar 24, 48 hours too early, because I expect we'll have more answers to this over the next couple of days.
And we can certainly work with the department in order to get that information out throughout our networks. Just a question here. I've not heard of this, Michael. A question from Alison Marcus, one of CHF's very experienced consumer advocates. There's been no real mention of Vax Tracker, AusVac Safety, some publicity about our local tracking of consequences of vaccine. Can you tell us about that? I've not heard of it.
Yes, so it depends where you've received your vaccine. Some of the states and territories will be sending you an email or a text message after you've received your vaccine, just saying, have you had any of the following side effects, and tracking that and reporting that through to the Therapeutic Goods Administration. If you report side effects from the vaccine to your GP or to the nurse who's given you the vaccine, they report through those side effects as well. And people can also make a direct report of their side effects to the Therapeutic Goods Administration as well. Right. So basically what's happening, these vaccines are very new. I mean, it seems like they've been with us for a long time, but these vaccines did not exist until the very end of last year. They've only been available in Australia now for the last 4 months or so. And so we're still learning about the vaccines, and we're still learning about the side effects and how often people get side effects. Now, most of the side effects are very minor, sore arm or redness at the vaccine site. Some people feel unwell the next day or two after the vaccine, feel like flu-like symptoms. I know when I had my first shot of the AstraZeneca vaccine, I thought I'd been run over by a bus for about 24 hours. I just felt achy all over, and then that got better. Some people can get allergic reactions to the vaccines, which usually occur in the first few minutes after vaccination, which is why we make you stay and get observed for 15 minutes after your vaccine. And then there are these very rare side effects, which we're reporting on as well. So it's really important, if people do have side effects, that those side effects are being notified and getting into the Therapeutic Goods Administration, so we understand more and more about the safety profiles of these new vaccines. And it will apply to the vaccines which are coming down the track as well. When we start using the Moderna vaccine, the Novavax vaccine in Australia, we'll be doing the same thing. We'll be tracking side effects of those vaccines too.
Thanks for that explanation, Michael. Another question we've been asked a lot is, do you think we can expect to see AstraZeneca phased out as the mRNA vaccines become more widely available? Given the reduced protection comparatively speaking, will those who have had an AZ shot need to be topped up, so to speak?
Okay, so there's quite a number of questions in that question. It's really about AstraZeneca. Will it be phased out? I don't think so. I mean, at the moment, of course, we're prior to yesterday, we were only offering AstraZeneca to those aged 60 and above. And once we had vaccinated everyone aged 60 and above, then we wouldn't be using AstraZeneca anymore. With the announcement from yesterday, there is the possibility that we may still be offering AstraZeneca to people under the age of 60 if people have that informed decision with the person who's giving them the vaccine. So it may or it may not. AstraZeneca is actually being used in 130 countries around the world at the moment. It's the vaccine which is being delivered the most globally. So I expect it's going to be with us still for some time. And it does provide good protection against COVID-19, including against some of the current variants which are starting to appear around the world. And the good thing about the AstraZeneca vaccine is after you've had your first dose, within 2 weeks or so, you have good protection. And that protection continues. The second dose, which we're currently recommending at around 12 weeks, gives you long-lasting protection against COVID-19. So my message to everybody is if you're age 60 and above and you haven't yet had your AstraZeneca vaccine, please arrange to get it today. We've currently had 68% of Australians aged 60 and above get at least their first dose of the AstraZeneca vaccine. So that still leaves 32% of people aged 60 and above who haven't done so yet. If you're 60 and above, please arrange to get that first dose. It'll be giving you protection within the first couple of weeks after you've had that first dose. And it's really important at the moment where we are seeing community outbreaks in a number of our states and in the Northern Territory. So please don't delay in getting that protection. Now, whether we'll need top-ups in the future, we're still to find out. And it's likely as new variants continue to appear that there may be some resistance to some of the vaccines we're using at the moment, which includes the mRNA vaccines, the current versions of Pfizer and Moderna, and the other vaccines being used in other parts of the world. So it may well be that we need boosters coming through. One of the reasons for the Australian government purchasing the Moderna vaccine, much of that will arrive next year, but we purchased the next generation of the Moderna vaccine with a view to having that available for boosters or top-ups for people if they require it as we move into next year, and hopefully as we look to having some more freedom of travel and perhaps opening our own borders as well.
And you mentioned the second shot, Michael. What's the advice on mixing vaccines? The AstraZeneca maybe is your first shot, Pfizer is your second. There appears to be some emerging evidence. That's our coffee van, in case you're wondering what that honking noise is. There seems to be some emerging evidence that this maximises protection.
Yes, so the advice from ATAGI is very firm, and that is to have 2 shots of the same vaccine. So if you've had a first dose of Pfizer, 3 to 4 weeks later, you get your second dose of Pfizer. If you've had your first dose of AstraZeneca, approximately 12 weeks later, unless there are other reasons why you need it sooner, you get your second dose of AstraZeneca. So really important, because most of the evidence, the research which has been carried out, has been carried out on 2 doses of the same vaccine. Now, there are underway some small studies looking at what we call mix and match, where people have had, for example, AstraZeneca first, and then for whatever reason have had a second dose of a different vaccine, Pfizer, Moderna, one of the other vaccines, and looking to see what level of protection, how long that lasts, whether it decreases the risk of getting infected with COVID-19 or being able to transmit to other people. Because remember, these vaccines, they do a great job preventing you from developing serious illness against COVID-19. But with all these vaccines, there is still the risk you may still contract COVID-19 and you may be able to transmit to other people. So this research is being carried out. We're keeping a close eye on it. But at the moment, we're not recommending mixing and matching vaccines in Australia. What we may end up recommending is that third dose, that booster dose, which you were referring to before. And this is called prime and boost, where you prime someone with the initial 2 doses of the vaccine, and then you give them a booster at a later date. So again, there's lots of research happening on that.
Thanks for that answer, Michael. Very clear. Lots of questions about information and people's ongoing, probably accelerating thirst for information. As you say, we're all learning this together, the government, clinicians, researchers, consumers. So there's a huge thirst for authoritative information out there, but there's also clearly variation in vaccine literacy across the community. There are those, as Rosemary's pointing out, Rosemary Ainsley in our Q&A chat here, that there are people that just don't have access to reputable websites, access to the internet for various reasons. So given the variation in health literacy, some internet access being an issue for some people, we know digital divide is an issue. You've in part acknowledged that as a government through grants for CALD communities, for example, to run localised campaigns through FECA. But what are the future plans for a really comprehensive, cut through, multifaceted information campaign?
Yes, so as the vaccine program moves through different stages, the communication does need to change and be modified. Originally, of course, we were targeting people working in quarantine, healthcare workers, the residents of aged care and disability care facilities, and so we had information targeting each of those groups. We then started moving through the age ranges. Clearly, the messages are getting out to those aged 60 and above, with more than 2/3 now having received at least their first dose, and many starting to get the second doses over the next few weeks. As we move the vaccine out more generally to younger people, the messaging needs to change as well. And we've seen that happening in some of the other countries which started their vaccine rollouts ahead of Australia, those countries which have had terrible impact of COVID-19 and actually started vaccinating people before they had full approval of the vaccines because of the emergency situations in places like the UK and the USA and elsewhere. So our programs will continue to evolve as well. You're right, Leanne, it's really important that we have targeted communication to different groups. The communications with the culturally and linguistically diverse community are very important. Working with FECA, working with SBS and other ethnic media outlets has been a really important part of the government's approach. Very strong work with the Aboriginal and Torres Strait Islander communities to get information out and to tackle any misinformation that may be circulating. Issues for getting information out to people with disability. You'll have seen, each time people like me are up and talking, we're accompanied by Auslan interpreters to make sure information is getting through to consumers who are deaf or hard of hearing. Things are captioned, things are available, lots of the information is available in easy read to assist people to understand the information and be able to make informed decisions. So we're continuing to evolve, but very keen to continue to work with CHF and with your member organisations. If you've got ideas about, particularly about groups of people who are missing out, because, I don't want to get to the end and we've got 95% of people vaccinated. Why have 5% missed out? And is it because of communications? We don't want that to happen in a country like Australia. So please continue to get that, share that information through to Leanne, and Leanne will pass that through to us as well.
Thanks, Michael. Well, I think the thirst for information is going to be ongoing, and we all need to tap what that is and work with the department closely on that. Have we got time for one more question? I know you are short on time. A couple of questions here about, evidence of efficacy and effectiveness. I suppose the broad question, there's several along this theme, but the broad question that perhaps captures it is, what evidence do we have to show our vaccinations are effective against the Delta variant? Is any particular vaccine more effective than another to that variant? What have we got on that?
Thank you. So this is obviously a really important issue, and it has been as each of the variants have been appearing, and we now have I think it's about 10 or 12 variants which are circulating in different parts of the world, but the Delta variant is the one which is worrying us the most because it does appear to be more infectious than other variants, and it does appear that people can transmit it more easily to other people. And we're seeing that in Australia at the moment. So the research is ongoing with all these vaccines, looking at efficacy and effectiveness. Some of the best research findings comes from real life experience. So it's when we look at countries which have rolled out large numbers of different vaccines, and we look at the penetration of these variants and what's happening. And the good thing that we're seeing is that people are not, we're not seeing lots of people getting sick who've been vaccinated. We're not seeing people flooding the hospitals being overwhelmed, the intensive care units being overwhelmed. So the vaccines that we've got look like they're providing good protection against serious disease, but we are seeing transmission occurring, infection and transmission, even in people who've been immunised. So in the United Kingdom, for example, which has rolled out Pfizer and AstraZeneca, as we're rolling out in Australia, they're still recording thousands of new infections each day. And that's concerning. In Israel, which has been a poster child for early vaccination with Pfizer and Moderna, they're still seeing transmission now occurring, including and especially worrying, of course, with those who had not yet been vaccinated under their vaccine program. So I think what this reinforces for me, Leanne, is the importance of all the public health messages, not just vaccination, but all the things that we have learned to do over the last year and a half to protect ourselves, our families, and our communities from COVID-19. The restrictions which are in place in many of our jurisdictions, the requirements to wear masks when mixing with other people, the physical distancing, and of course, incredibly importantly, if you have symptoms, no matter how mild, you isolate and you get tested to make sure that you are not a carrier and able to transmit COVID-19 to others. So although we're focusing on vaccines today, please continue to reinforce with all your members the importance of all the public health measures, because this is what is going to protect us, and this is what is going to help us to be able to get on top of the current outbreaks, which we're seeing around Australia.
Thanks very much, Michael. And that's an important point. Absolutely. This is classic population health, isn't it? You know, it's sort of like tobacco control. There's not one single measure that is the solution. We need all the human behavioural behaviours happening, washing your hands, social distancing, along with the vaccine, and many other measures, including keeping clinicians up to date. I've got a few more questions on clinician preparedness and information to them, but I know you're probably now going to have to leave us, so we might put those to Ruth. A couple of questions I'll put to Ruth now that perhaps she can field, and then we'll come to Diane and then back to you, Ruth, for the last half hour, if that's okay. So thank you so much, Michael.
Thank you, Leanne. And if there's any questions which stump Ruth or Diane, I'm happy for you to contact me afterwards, and we'll
work with your team, because we have several. Just to our audience as well, we do have several, both in advance and in the chat box now. So we will work with Michael and his team on getting answers to those back out to you in a cohesive, easily explained way, I hope. So thanks again, Michael. Really appreciate your time. Thank you. So Ruth, I hope these questions don't put you on the spot, but I don't think they will, but I just thought, you know, as a GP and a clinician, as well as the National Rural Health Commissioner, there's just a question here from Susanna about what's the government doing to ensure that clinicians themselves have the up-to-date and full information to advise consumers. It's one thing to say, go and talk to your doctor, but I guess we're all looking for some assurance that they've got at their fingertips the most up-to-the-minute information and advice as well. Just your thoughts on that.
So the government is doing a couple of different things. Now, I need to explain first. Sorry, everyone. I'm sitting in the Qantas Club in Cairns, which incidentally is on Gurindji and Yirrakanji land. So I acknowledge the traditional owners of this country. So really, the communication is the crucial bit. The information is being regularly sent out to GPs by both of the general practice colleges, the Royal Australian College of General Practitioners, known as RACGP, and also the Australian College of Rural and Remote Medicine. There are regular updates if your GP is running what's known as a general practice respiratory clinic. They also have a higher level of contact with the vaccine section of the Department of Health, and they get information as well. And anybody and everybody can log on to the Department of Health vaccine websites, which have excellent information, both for consumers and for clinicians. But I suppose it's like anything. I'm sure many of you here have been parents of teenagers. You can tell them any number of things, and it depends whether they're listening. So I suppose, I trust and hope that your GPs are paying attention and listening. And if you don't think they are, ask them if they are regularly reading the updates that are sent out by their college and by the Department of Health.
Thanks,
Does that
Ruth.
answer the question?
Well, I mean, I think it does. I mean, obviously the professional colleges are highly engaged, and it's good to have that reinforced by you, highly engaged in keeping their members up to date around the developments as we are with our members. You mentioned being parents of teenagers, and with the announcement last night about opening up the option to opt into AstraZeneca for under 40s, we convene a youth health forum here at CHF, a network of very active, very informed young health advocates. There's a question here in the Q&A, Ruth, about given the focus that seems to be on talk to your GP, how does this factor in young people or others who don't have a regular GP for various reasons? And I think you might want to answer this one too from the rural primary care access perspective. There's a lot of towns who don't have a GP. So where do people in those young people who don't have a regular GP, people in rural Australia who don't have a GP at all, where's their source of truth, their source of advice, their source of counsel?
So as I've already mentioned, if people have access to the internet, which, as you and I both know, isn't always the case in remote communities, but if people have access to the internet, if you go to the Australian government, if you Google Australian government vaccine information, there's an absolute treasure trove of really easy to follow, understand information and resources. So yes, there are detailed ones with big long words that I like to read because I'm a doctor, but there's also everyday language, consumer-oriented information too that's regularly updated. So I can't recommend that to you highly enough. The other thing I would say is if you don't have a general practitioner in your community, it's really, really likely that you're going to have a primary health centre of some sort, mostly staffed by a remote area nurse or an Indigenous health worker or practitioner. And they too are keeping up to date with the vaccine. And so go and talk to them. I was listening to Minister Wyatt on the phone, I was listening to him on my phone, but it was a Radio National segment last night with RN Drive, and he was talking about the problem in in remote communities, when you don't have much access to information or much access to the internet, you tend to rely on whatever you see first. And I know from the Torres Strait that everybody is on Facebook. That's where you keep track of family and friends and keep in touch. But you need to be careful when you see some information, compare it to what you're being told through official channels. I've personally seen some really ridiculous ideas that distress me a lot being circulated on social media. The basic facts that we know about vaccination is that it's much safer to be vaccinated against COVID-19 than it is to be to come down with it. Your risks if you have COVID-19 are probably in the range of 2 to 3% or 5% of being hospitalised, 2% of being in intensive care. The serious risks of having the COVID vaccination are about, for the first round of an AstraZeneca, is about 14 in a million. So that's way less than 1%. So people need to keep these risks in balance. And yeah, so when you see things that don't align with what you're hearing through official channels, wonder about the basis of that statement and follow it up. And go and talk to somebody you trust, who you know is knowledgeable about health. Because it's emerging that the very best way to protect yourself and your family and your friends from COVID-19 is to be vaccinated. I'm really struck by Brad Hazzard's announcement. He's the New South Wales Minister for Health, that there was a party where they're calling a super spreader event, where there was a person with COVID-19 at the Delta variant. There were 24 people there. There were 6 people who were dual vaccinated health workers. None of them got COVID-19. Everybody else. And so there was one person who had 1 dose of the COVID-19 vaccination. They didn't get it either. Every other person who was not vaccinated got COVID-19. Now, I can go on and talk a bit more. Will I talk a bit more about remote and rural areas, Leanne?
We might come back to that in a moment.
Yep.
Ruth, I'd like to bring in Diane now and introduce Diane. She's a long-standing consumer advocate with an interest and expertise in medicines and vaccine quality and safety. She's actually a consumer representative on ATAGI, but she's not here with us today wearing that hat. But I think that just speaks to her expertise in this area from a consumer perspective. She's here today as an independent consumer advocate. So I'd like to introduce Diane. You're in lockdown in the NT for the first time, Diane. How does that feel?
Well, we are, and I would like to also acknowledge the Larrakia people, the traditional owners of the land that I live and work on, and their elders past, present and emerging. I think we're very grateful for their custodianship of this land, and very mindful, of course, of the specific risks to Aboriginal people in Australia with their sometimes additional health compromises and so on. So it's front of mind for me in the Northern Territory. So yeah, this is the first time for us. We did have some restrictions placed on us very early last year for about 6 weeks, but they were quite minor compared to this. So I guess it makes it real. And in the NT, I think we've known that there's been clear and present danger. We've got the massive international quarantine facilities sitting on our at the edges of the city, and many people I know actually work there and in the other quarantine facilities, particularly young people. Some of my own children's very closest friends are working in those facilities every day. So we're all very aware of those risks. So I think it's been inevitable. And I think coming to some of the rural and regional issues, I think that people out in the peripheries, we felt a little safer perhaps. You know, it's all been happening in the big metropolitan centres, and we've been a little more complacent about those things that Michael raised for us, you know, the masks, the hand washing, just the regular social distancing, checking in. We have a check-in app that's in the Northern Territory has been very poorly used up until now. And what we're seeing, of course, is that, you know, things like the contact tracing are absolutely critical to being able to contain these outbreaks. So I think perhaps there's some lessons for all of us that no matter where you are, the situation can change in a moment, as it did in the NT on Sunday, and that we all have to be alert to the same sort of safety mechanisms and measures that other people around the country have made their everyday that part of their everyday life for the last sort of, now what it is really getting close to, I think it's 15 or 16 months.
Yeah.
I was also going to say that I think that it's been quite good here, because there's some lessons for some other parts of this conversation, that the rules are very clear here in the NT. There's been quite wide community acceptance. I have seen very little kickback because it's pretty clear. There's 5 reasons you can leave the house, that's it. If you do, you should have a mask on. And those messages are simple, clear, and being well repeated by every source that we see. So it's not difficult to follow those. And as I said, there's been good community acceptance. So I think that that's how it's going up here at the moment. We'll see, you know, by the end of the week, people might be getting a little less compliant, but it's been a very interesting time for us, that's for sure.
Thanks, Diane. It just serves to reinforce, doesn't it, how rapidly the situation can change. And one of Michael's key messages, which was the vaccine's not our only piece of armoury in this. It's a really, really important piece of armoury, but there's all those other behaviours that we can adopt as well. So before I come back to Ruth, just more generally, Diane, you were, you know, just listening into the questions and the sentiments from some of those questions. We've got several others, but just the conversation with Michael. Tell us what you think are the main issues top of mind for consumers, and your thoughts on what needs to be done about those.
Well, I think for me, it's the dealing with uncertainty and constant change. And that is no different for consumers than it is for every health professional, every researcher and advisor out there. And Leanne, you know, you said from CHF right to up to the top and down to every person in society, it's change, it's regular change, and the evidence is evolving every day. So making sense of that in this plethora of information that's out there, I think, is the really most important issue for everybody. And coming back to my NT analogy, that, you know, it's really clear. We can do it. It's easy because it's clear. Whereas the evidence around vaccination, Michael has made those made some very clear statements. But for every individual, we all need to find our own trusted source of information. And again, I refer back to, you know, Michael and Ruth have both said, you know, look at the government websites. The information is there, but there's so much of it that wading through it is really quite complex. And that's where you come back to Ruth's point about a trusted source of information and having a conversation with someone you trust. And then that leads on to accessibility of general, you know, GPs and that your trusted health professional. And when you've done those two, when you're dealing with uncertainty and you've accessed information, the next part of the equation really is about evaluating risk versus benefit. And that risk versus benefit is different for every single one of us. The situation we find ourselves in today and the situation we might find ourselves in tomorrow, our family, our friends around us, the community that we live in, and where our own personal values sit, I suppose, around, you know, how we evaluate personal risk compared to community risk. And I think that was raised as well before. You know, it's a public health issue as well as a personal health issue. And it's quite, it's challenging to bring all of that together in a space of shifting evidence. So I have been reading all of the questions in the chat and the questions that came in before. And a lot of questions are quite specific as well, which there was no way Michael could answer those in this forum. But they're very specific because everybody has their own, those with underlying medical conditions, those people who feel that their risk factors are different. And to be able to evaluate the evidence and have that conversation with a trusted health professional is much easier said than done. And it's a conversation had at the tables, the committee tables around which I sit. How do we, fund health professionals, as you talked about with Michael, to actually be able to have the time? But it's also about having consumers who are confident enough to ask those questions in what is quite often, my own personal vaccination experience was very brisk. It was a lot of information was asked on a form, so I spent a lot of time in the waiting room. I spent 15 minutes in the waiting room at the end, but my time with the health professional was very, very brisk. And it would have been quite difficult if I'd had serious questions to ask, I think, to have those addressed.
That's right. And you're right. You're absolutely right. We're in an era of very personalised medicine where people do expect that and should get that and personalised care. And to Susanna's point, you've raised several points about communication here. That it is about underlying medical advice. This is all general advice. It's all we can give in a webinar like this, but we'll pick up on some of those more specific questions later. So Ruth needs to get on her flight very soon. She's telling me. So do you need to go now, Ruth?
I've asked them to give me a little bit more time.
Okay.
He said he'll see what he can do.
So maybe in the little time we've got with you, just some comments from you from a rural and regional perspective. And one of the things we're hearing about, again, which is of concern to everyone, consumers and clinicians alike, is the whole workforce fatigue issue that came through very strongly in some of the webinars that we've been doing jointly with the National Rural Health Alliance. Workforce fatigue is a real concern, I would imagine, particularly when that, most doctors are altruistic and they want to spend the time with patients to answer their questions. We've got counselling items now. So just some thoughts from you and observations from you on that.
Leanne, I think that the COVID-19 pandemic has just uncovered or underlined really the challenges facing the rural and remote healthcare workforce. We don't have enough people out there doing the work. And also going into rural communities takes a lot of time, costs a lot of money, and the supply chain is very long and a bit thin. So I suppose I'll just get you a couple of points. Yes, you're right. The fatigue is absolutely really hitting home. So if you're in a rural or remote community, maybe reach out socially to your healthcare professionals and tell them that you know how hard they're working. Even a little comment like that can make a big difference. And think about things that you might be able to do just to relieve some of the stress and pressure that they're under. But I also want to just explain that because of the long distances, the challenges of getting vaccine particularly into remote communities, are really heightened. You need to get together a team of people skilled to deliver. Sorry, that's my phone. Skilled to deliver the vaccine all at the one time. At the same time that the vaccine is there, the vaccine has to have been thawed and must be delivered in less.
I'm Stuart. They just need to take you to the aircraft.
Okay, I've got to go. Sorry.
Okay, all right.
It's got to be given in less than 28 days after it was thawed. So once you take it out of the deep freeze, it's got to be delivered really soon. I am so sorry.
Look, that's okay, Ruth. We do not want you to miss your plane.
Going home.
Yes, and you don't want it. You want to be there as well. So look, again, appreciate your time. Thank you very much.
Bye-bye. I'm sorry.
Thanks,
about
Bruce.
this.
Thanks. So we've lost our two medical experts, but I think there's a couple of questions or comments really here that we can use the remaining time to discuss with Diane. Just a comment here from Alison Marcus, Diane, about please discuss long COVID, something that really sways the risk benefits.
Yes, I guess that's a medical question, and I don't want to delve into the medical details, but I suppose it should be a factor of people's particular personal risk benefit analysis that you may contract COVID and think that obviously that you won't be ill for very long, and that a lot of people get better quite soon. I saw that in some of the questions consumers sent in prior to this going online, but what are those ongoing effects? And the research is, I guess, it's a new illness, the same as the vaccinations, right, and the medicines are new, and all of that is another evolving information space. I don't feel very comfortable talking too much about it because it's not something I know about. But I did have a look at Susanna's comment as well about whether the information to consumers.
That one next, absolutely.
Yeah, that's all right. I've got my
Thank
chat
you.
here on my screen as well, and whether it's been clear and consistent. And I guess the processes are the process of updating the information on the government website is in fact weekly, and at the same time as practitioner information is updated, consumer information is also reviewed. It's not simple information, it's deep level information, and delving into that is clearly quite a task, and you really need to be prepared to sort of perhaps research some unfamiliar topics and so on. But then that's the balance between transparency and trying to give consumers access to equal quality information without making it too simple, so that in fact you minimise people's responses to people's real concerns. There's certainly been discussions about having different levels of information, so that there might be multiple resources, and some of which would be at a more basic level. But again, the people who are producing this information, Ruth tried to give a picture of what it's like to actually give out the vaccines and all of the complicated processes that go around that. Producing the information is a monolithic task, and that the rate at which information needs to be updated is obviously huge. And so then producing it at 2 or 3 different information levels is also a pretty big ask for people who are already working very, very hard. But it's a topic that's on the table, so it's not a thing that won't happen. It just it hasn't happened yet, but there are definitely people working.
And I think part of the challenge is people just, I mean, it's great to have government websites, don't get me wrong, as the source of truth and the source of authoritative information here, but people don't intuitively necessarily go to government websites. They might go to something like Health Direct, which might come closest to something like that, but and we all play our part in driving people to that. But I think people get their contemporary information, as Ruth was saying, through their devices, Facebook and those sorts of things. So I think it's so complex, as you say, but it's got to be multifaceted. And back to your point, Diane, it's useful to remind listeners to this webinar that it is a new illness. We're talking vaccination, obviously, on this webinar, but preventing it and treating it. There is the COVID Living Evidence Task Force that's been funded by the Commonwealth, which is pumping out, virtually not quite daily, but very, very, very regular information back to the question about how are we equipping clinicians, not so much on the vaccination side, but on the prevention and treatment side of COVID. There is that Living Evidence Initiative. It's pumping out fresh evidence as it comes to light from across all sorts of sources to the clinical community very, very, very regularly. And there's been a consumer panel and consumer advisors tapped into that task force. We did a webinar on that at CHF a couple of months ago. So it is on our YouTube channel too, if anyone wants to find out a little bit more about COVID living evidence and what's happening on that front. I just thought I'd mention that at the time. Probably the last thing to sign, just another message to sign out on with this, two things. We will collate all the questions, as Diane said, and as she's observed. Some are very general, and this has really only been about general advice, which is all you can really achieve in a 55-minute sort of webinar. But we will collate some of the specific questions and answers and get those out to you to the extent we can in consultation with the department. Just another reminder too that, again, from Alison, another one of our very informed consumer advocates, just a reminder that consumers have their vaccines or should have their vaccines recorded on the immunisation register. And there was some advice that came out this morning that the upgrades, the 23 June upgrades to My Health Record, consumers can now get their full immunisation history statement on My Health Record to show proof of their vaccines. So that's just something to note as well. So I might just have a quick squiz through the final questions.
And Leanne, while you're doing that, I was just going to comment again to really urge people to complete those surveys that come to you after you've, if you're at a provider who actually sends out the Ausvax safety LVAX tracker surveys, because that's again a living source of evidence. It grows every day, and it's monitored really closely with it, so that any changes in safety signals and things can be picked up as in close to real time. So really urge your friends and your colleagues to do those surveys.
Okay, look, on that note, thank you all for your participation and engagement with your questions. Thank you to Diane for your advice and consumer insights there, and for your continuing work on ATAGI. In absentia, thank you to Professor Michael Kidd and Dr. Ruth Stewart. Hope the information we've been able to cover in this short time today has been of use. As I said at the outset, it's every day there's something new. So there's a lot of information we are all trying to absorb and navigate and understand. We'll continue to do our best at CHF to bring you information and webinars with experts like this one today over the course of the next year. So on that note, I will sign out and thank you all very much. Thank you. Thanks, Diane.